Conversations happening in households all across South Mississippi about health and well-being, and mental health is a key piece of that. We've got Dean Doty, who is in charge here at Gulfport Behavioral Health System.
Correct.
How are you?
Good, good. Thank you, Chip.
Thanks for being here.
Thank you.
So let's talk a little bit about substance use disorder.
Okay. You know, we see that that prevalence with folks that often have a mental health issue as well, and about 1 in 5 people will suffer some sort of substance use disorder catastrophe throughout their lifetime, and most will not receive help for that.
Well, I think a lot of times we have substance use disorder, or substance use issues, and we'll start there. A lot of them spring out of completely normal situations where someone has been prescribed a medication and then it just gets out of control from there.
Yes, and same thing with with alcohol. You know, there are lots of people that will drink and it's okay, and they can have fun and they can party. It means conviviality and joyful release from care, and and then others that they don't have that ability. And so we believe that there's a genetic predisposition, and there's also hereditary that that impacts that potential to become addicted to, whether it's a pharmaceutical, an illegal drug, or even alcohol as well.
Well, and you may have those people that are like, well, I don't have an addictive type of personality, so this isn't going to bother me. It's just one time I'm going to be fine. Right.
Well, and sometimes people are just they're playing Russian roulette, because you really don't know until, because there are other factors such as traumas, some environmental issues that can lead to it. But also, if we look at mental health issues, someone that has extreme anxiety or even attention deficit disorder, and they use a substance that gives them relief, and they finally get relief for this mental health issue, they're going to continue to use it. And then they become dependent upon it, and then it becomes progressive, and then it becomes problematic. So then at the end, they'll have to not only deal with the substance use issue, they're going to have to go back and deal with the mental health issue as well.
Which just compounds everything. Yeah, so tell us, for our viewers out there that may be able to resonate with some of the things you're saying, what are some of the signs they want to be on the lookout for? What
I tell families and parents and loved ones to look for is any changes in behavior. If you see any kind of rapid change, such as being more withdrawn, seeing some more having bursts of energy, money issues, relationship issues, any kind of change, it's important to start asking questions. And I encourage families. There's this. In our society, we tell people to call 988, reach out for help. But I think we need to start reaching in. So if we see something going on with a loved one, I think we need to be a little more intrusive and say, hey, what's going on with you? I see something's happening. Could you tell me what's happening? Because a lot of times we just we don't want to upset anybody. Well, sometimes I know families who would rather have upset their loved one than deal with the aftermath of something happening.
Absolutely. The adverse is not what you're looking for. And listen, we hear it all the time. It's okay to not be okay.
Yes. And
you have to recognize that, and you have to embrace that mentality, because it's in knowing that something feels like it's not okay is where you begin that recovery.
Yes. And 1 in 4 people are going to have a mental health crisis in their lifetime. And so when we look at children and adolescents, for example, over 50% of them that have a mental health issue are not going to get their needs met. 1 in 2 will not get any help at all whatsoever. And so they will continue to suffer throughout their adolescence and young adulthood, and then they can start to have some maladaptive coping skills or substance abuse issues as well. And suicide is the second leading cause of death for young people.
That's staggering. It's hard to stomach that. But when it comes to adults, a lot of times they will have issues in their childhood that they just were like, they're, a lot of adults, a lot of folks will say, well, they're kids, they're resilient, they'll bounce back. Right. Until they don't, and then they become an adult that has an issue that could have been put to bed when they were a child if it was just recognized.
Right. Like men, for instance. A lot of men will exhibit depression as irritability or anger or frustration. And so, men in society say, just get over it or deal with it, and a lot of times you just can't get over or just deal with things without some assistance.
Absolutely. It takes me back to the phrase, well, that'll buff out, or just rub some dirt in it, you'll be fine.
Right, it'll come out in the wash.
Yeah. And that wasn't a great response then. It's an even worse response today because we're beginning to embrace this.
Right.
And so why is it, do you think it's important? We haven't really discussed a lot about adolescents and children. Why do you think it's important to really begin to recognize those things so that we can get ahead of it for the kids?
Well, if we can get them to start engaging in some better mental health, then they'll have a better outcome in life. And they'll make fewer decisions that are decisions they wish they had not have made, whether they hurt themselves or other people, because the old adage, hurt people hurt people.
Sure.
And so if we can get our youth a lot healthier and a lot more empathetic and compassionate towards themselves and one another, I think our society will improve greatly.
So speaking to some of those parents out there right now that may be watching with children who are having some of these challenges, what are some of the treatment options that you offer specifically for children and adolescents? We
have an inpatient hospital here for children beginning at age 4, and those are the children that are threats to themselves or others, that are really acting out and uncontrollable. And we also do outpatient services as well. We have an intensive outpatient program where teens can come several times a week, and they'll have peer groups, they'll have therapy, they'll have medication management if it's appropriate, and then also we have partial hospital as well for those that need that level of care.
And this doesn't necessarily mean for a child or an adult, but for a child that is being referred, they could just, if parents see that there is an issue that needs to be addressed, they can just come in.
Come in 24/7. We offer no-cost assessments in person by a clinician. Most, I think we're the only ones on the coast that offer that 24 hours a day, 7 days a week at no cost to anyone.
Because you never know when something like this is going to happen.
Correct.
And you have to be able to manufacture that interaction for the specific patient based on that patient's needs.
Correct.
Yeah. So you see there down at the bottom of your screen, Gulfport Behavioral Health System. This is Dean Doty. He's the CEO. He's the man with the plan. He's in charge. He's running the show here. If you feel that there's something a little off, if you feel like you're not okay, give them a call. You see that number there at the bottom of your screen. Plenty of clinicians here to help, to be able to figure out what's going on, or at least get you on the path to figure out what's going on so that you can get back to that quality of life. Absolutely. Dean, thank you so much.
Thank you, Jeff.
Absolutely.